The Kenya Medical Supplies Authority Board now says former CEO CEO Manjari must carry the cross following fresh integrity questions facing the authority. The board acknowledged that issues raised in the Global Fund audit report, which happened during the tenure of Manjari, were the same issues that they were dealing with in reforming the authority. The board came into office in May 2021 after the suspension of the former board over the 2020 KEMSA scandal. The Global Fund audit report has flagged irregularities at KEMSA, in particular missing condoms, mosquito nets and tuberculosis drugs worth millions of shillings.
In a statement sent to newsrooms by KEMSA board and signed by Chairperson Mary Modime, the board has distanced itself from integrity queries raised in the Global Fund audit report. The board has put the blame squarely on the previous regime headed by former KEMSA CEO CEO Manjari, who was suspended following the multi-billion COVID-19 kits scandal in 2021. In their statement, the board acknowledged the contents of the audit report carried out between January 2018 and April 2021, which described the procurement and supply chain management systems during the tenure of Manjari as ineffective and said that the concerns raised are the ones they have been working to resolve. The board says it had identified the challenges corroborated in the Global Fund audit report, which were lack of financial controls and structures to optimize the collection of outstanding debts, supply chain crisis, warehousing and distribution chaos, and procurement chaos. The audit report raised concerns over loss of health commodities at the troubled Kenya Medical Supplies Authority. The report dated 11th March 2022 from the Office of the Inspector General of the Global Fund indicated that KEMSA could not locate 3 of 8 batches of TB medicines worth 10 million shillings. There was also the discrepancies between the actual and expected stock balances, with 1.1 million condoms missing and 908,000 mosquito nets unaccounted for. The statement further says that the board in the past 10 months has embraced information technology systems with the rolling out of KEMSA electronic proof of deliveries that keeps track of deliveries to primary health facilities, unlike before, where KEMSA lacked the system to ensure commodities are distributed at health facilities on time and in the correct quantity. On the reforms of the troubled authority, the board says they have achieved a 65% progress rate against the target set to be achieved by mid this year. While in support of the universal health coverage, KEMSA procured health products and technologies worth 35.84 billion shillings and distributed to more than 11,500 health facilities in the last financial year. The board, which developed a KEMSA transformation strategy to guide their reform agenda, says they have stepped up engagements with stakeholders while seeking resources to underwrite the ongoing reforms. The KEMSA board says it will work with the Global Fund and other partners to address the key issues and risks identified under the audit.